Thanks for listening to The Special Lists, presented by Referral Lab, the podcast for dentists and dental specialists.
All right, and welcome to another episode of The Special Lists. I am joined by my co-host, Jason Suyos. Unfortunately, Dr. Michael Sato is not able to join us this evening, but that won't slow the conversation down with my guy, Amit Patel from Dallas, Texas. Welcome, Amit, to The Special List. Thanks for joining us.
Welcome.
Thanks for having me, guys.
Yeah, man, it's great to see you. Great to know you. I've been a friend of, we started off as an interesting conversation with Margis, right? That's how we got to know each other.
It's a long story. I don't know if it's worth sharing on the podcast, but it involved a few drinks, and we got introduced. And Cameron's like, "Let's just talk the next day when we're all sober, or when Margis."
Yeah, he and Margis were hanging out after some study club stuff, and I think you guys called me like 9:30, 10 o'clock at night. You had a couple of glasses of wine or whatever, and I was like, "Hey, man, I'm down. Give me a jingle tomorrow. Like, let's get this healed."
Yeah.
So Amit is the owner-operator of Root Periodontal Implant Centers, Root Med Spa, and co-founder and managing partner of the Center for Oral Pathology, which actually is pretty cool, novel concept. Born and raised suburbs, Detroit, Michigan, moved to Dallas in 2010. He is a Lions fan. Went to undergrad and dental school at the University of Michigan. He is a Michigan fan as well, and did his para-residency at Indiana University. Are you cheering for Indy right now? What are you doing?
I mean, I was out of it for a while.
Big Ten. Go Big Ten, baby.
I'm going to choose for Big Ten. Yeah. I'm going to
Yeah.
for the Big Ten.
He's director of Seattle Study Club at Dallas and coached the DEO, which has been a pretty cool thing. We just talked about this past weekend in NASP when we were together, is about how he's really enjoyed working that type of function. Notable achievements. When he co-founded the Center for Oral Pathology, which is now the biggest private practice in North America dedicated to clinical and oral pathology in medicine. And then last year he started Root Med Spa. That Center for Oral Pathology function, when we talked about that a couple of years ago, when you got it going with Pros, it was such an interesting concept. Before we go into the actual function of the special list itself, tell us a little bit about what CFOP is.
Yeah. So, we're the largest privately owned private practice oral pathology, oral medicine group in North America. And the reason why it came about was, as periodontist, we do a lot of biopsies. And we'd send these biopsies off, CUS can attest to this. We'd send these biopsies off to, in our situation, was a local school. I mean, the return rate on these things was not ideal on getting our reports back. And some of these people could have precancerous lesions, even cancerous lesions, amongst other things, suffering from some pain or some symptom of anything oral related. And we get these reports back. And obviously, I can't speak for Jason, but I had no idea how to manage these cases. And over the years, and we did a lot of biopsies. I was very, very aggressive with, if I saw something abnormal, at least testing it for ease of mind or biopsying it, because, I lost my mother to cancer. So I know how going through that process is just not something I want anyone else to go through. And this is something that's so preventable. So when we get these reports back and, have a diagnosis, and there's really no description of how to manage these cases, like watch them. And I'm like, well, I'm not able to watch these things to the detail that an oral pathologist can. So we'd send them back to, the providers that we were working with, and we would get constant complaints from our patients that it was hard to get in. They would wait hours. They wouldn't, they weren't getting connections with their providers. So I finally said, I don't know if we can swear on this podcast or not. I won't, but we finally said,
You can swear.
All right. We said, fuck it. We're going to start our own group.
That didn't take long. How many minutes in? All right.
Rules,
There's no rules. There's no rules.
All right.
It's internet TV, baby.
And so, I found this other oral pathologist, Oral Patel, who happened to work at Texas A&M or Baylor at the time. And him and I had a similar vision, waited for his contract to end, and we said, let's do it. So we planned it over like 2 or 3 years and finally launched in July of 2022. And it's been,
has it been that long already?
It's been three and a half years almost. Yeah. Wow. It's been a game changer. We were at three locations. We're consolidating to one big center. We just found the spot here recently, and we're getting the contractor to give us bids. So we're going to have like about a 3,000 square foot facility with 2 oral pathologists and an oral medicine. So we implemented oral medicine just this last year.
Wow.
So now we're able to treat TMD and oral facial pain, which is huge. So we've really opened up the scope of what that group can do. And it's all private practice, fee for service. They see close to, I don't know, 150 new patients a month, 125, 150 new patients a month,
Wow.
over 200 referrals coming in. So it's been great. It's saving lives. It's getting people out of pain. It's not the most lucrative, which is not why we opened it, because it's not very procedural based. It's more management
Mhm.
and prevention, which is we're totally that was never our goal, was to make this huge business venture. It was more to give access to oral pathologists throughout DFW.
Sure.
That's awesome.
Well, and you mentioned saving lives, and that kind of partners with one of your main philosophies at Root, which is saving teeth. And so for those that don't know Amit, he's actually pretty keen marketer. He does a really good job of packaging, Root comprehensively. And that's where some of these other functions have come from within his platform. But I love, when you sent that stuff over originally a couple of years ago for We Save Teeth, I was like, holy smokes, this is brilliant. Because everybody and their mother's trying to do the opposite, right? Like everybody's dropping implants. I mean, everybody says that they're trying to save teeth, but nobody goes out there on a limb and really publicizes that and then reinforces it with how they treat their patients. Amit, like, talk about that marketing function and then what you did, philosophically at the practice to support that.
Yeah, I appreciate the positive feedback there. We started this about 5 or 6 years ago. It was around COVID time, where we started realizing that in Dallas, especially, the Metroplex is very competitive. And I know everyone says that their different geographical regions are competitive, but Dallas is a different animal. I'll promise you that. Literally, like, periodontists on the same floor as us across the street. Like, it's very, very saturated. We're trying to think of things that could differentiate our group from other competitors. And we really don't think about competitors. We think about, instead of competition, let's just be creative. And one of the things that everyone was doing in Dallas and throughout the US, actually probably internationally,
Implant specials.
implant specials, pushing the all on X, right? Like
Yep.
full arch became such a big deal. And honestly, not myself and none of my doctors, we actually now partner with another group to do all of our full arch, because we didn't really enjoy doing them ourselves, even though we did a lot of them. There's a lot of work that goes into full arch. So we said, screw it. Let's actually market the opposite, that we can save your teeth. Because we were getting, I'm sure as Jason was, so many second and third opinions on, like, do I really need to extract all my teeth? And we'd get them in. We're like, no. Now, it's nothing that's unethical of what someone else proposed to remove them all. Because if someone went to them for a consult and they wanted to extract their teeth, that's fine. But if we're able to save what they were naturally given at a fraction of the cost, almost a fifth or sixth of the cost, why not? And it's picked up. We probably do some of the most, periodontal surgeries with LANAP, for example, in the US. If we had to add up how many LANAPs we do within our 7 offices, I can't even count. And it's been revolutionary. Almost no complications. You don't have failed implants. The patients get to keep their teeth, which they love. And we're not trying to be heroic. Like, if they're freaking hopeless, we're getting these teeth out, right? But at least give them an opportunity to try to save them.
Yeah, but a lot of times that's happened, in the full arch market, because people view it as being so simple, so easy. You're done in one day and I've got teeth I don't have to worry about, especially the marketing that's out there that the public sees, right?
Sure.
Like, I get patients that ask me all the time, how do they do this where you get an implant in one day? And I'm like, well, it's not one implant. That's always the thing, right? Like, it's doing a full arch at the same time. But when you Perio, I think, is awesome in the fact that we've engineered that keeping and saving your teeth is a fraction, like you just said, a fraction of the cost of having to replace them all like that. And honestly, there's nothing better. There's nothing better than keeping what you started with, what you were naturally given, right?
100%.
And I love that you've done this campaign and marketed this in the DFW area. And like, what brilliance and genius, because like you said, Cam, everybody and their brother, like is trying to get into the implant market because everybody, they see, the price tags that go with it. But like, as a patient, there's nothing better than having to to keep what you started with.
I think the trust that's baked in too with that, like, especially if, let's say, for instance, they go to Root, right? And they see Amit and all of his marketing's forward with trust building and saving your teeth, right? Then they go down the street to the next periodontist and they have the next conversation. And he's, he or she is talking titanium and all that stuff. I mean, what kind of trust building engagement happens with the person that you talk to first or whatever that is leaning towards, hey, while this might not work forever, the reality is we can help you keep them for a little bit longer.
Where we made our biggest mistake years ago is we were marketing more to the public in regards to save teeth. We actually try to get a trademark. We save teeth, and it's with the, I don't know what you call it, United States Trademark Office and
USPTO.
Yeah, generic and too simple, and can't trademark that, but we can use it locally and actually, have a cease and desist because we have been marketing it locally all these years. But the problem that we realized, and we realized this after we were doing, we do about 150 to 200 lunch and learns a year between all of our doctors. And what we realized was over 50% of our doctors, not even just the team members, the doctors had no idea what LANAP was or LAPIP. And they had no idea that we had this technology to save teeth. Because I think the periodontal education in dental school, I mean, they can just do what they can do, brush the surface, right? And so a lot of the technology that we learned through residency has not been educated to the undergrad students. And so we were in shock when we realized that if our referring doctors even know that we have this technology, they're not going to be recommending it to their patients. And they're probably just going to go ahead and extract the teeth or refer it for a full mouth extraction to an oral surgeon or, someone else. And so we dug even deeper and found that we need to get to our referring doctors and their teams first to educate their patients that we can save these teeth.
How do I know, and I remember what else is cool. Like, I wish I could show this, but he's got this, how they save teeth philosophy, in there, and how they market it to the referring provider, and then obviously qualify it with the patient that come in. How do you integrate Perioscope into that as well, Amit?
Yeah, so that was another thing that we realized is most of the offices, again, the doctor and the team didn't even know what a Perioscope was. So what we ended up doing was the way the Perioscope came about and why we integrated into all the practices was if a patient was referred to us by a restorative doctor that had like 8 or 9 millimeter pockets, most likely did the scale and root plane or initial non-surgical therapy in their office, did a re-eval, send it to us because that's that's probably the best results they can get. They would come to us, we do a full consult, build the trust, and then present surgery. And a lot of times, for whatever reason, usually not anxiety or fear, because the LANAP, we can show them how there's minimal, post-operative discomfort and swelling and complications. And they're sedated, they're under IV sedation with our anesthesiologist. But most times there's a financial, obstacle to be able to afford the surgery. And that's something, honestly, as much as we're not really big pushers, like go get a mortgage on your house and do this and do that. Unless it's a big case and they really want it, then we'll give them ideas. But that's not our first line of, offense to try to get them to do something that's going to help them. So what would end up happening is we would just alternate these cleanings every 3 months with the general dentist. They would get frustrated. We would get frustrated. Our hygienist would get frustrated, the patient, because it's a progressive condition. So they're just getting worse and worse and worse. So I was thinking about where's there a middle option that could potentially be 50 to 60% as good as surgery, but not as expensive as surgery. And long story short, we looked into the Perioscope through many of our contacts through Jason and you, Cameron, that you guys introduced me to, Marcus Stams, Aziz Bora. These guys have implemented, the Perioscope in their practice, not only non-surgically, but surgically too. And what we realize is, one, the Perioscope is about a fourth or fifth of the cost of the full mouth LANAP in our practices. The results are phenomenal. Not as good as surgery, which on the gold standard surgery. But when we actually pair the Perioscope with the LANAP, I can guarantee no one in our area has results like we do. We're cheating. We can see the calculus and the tartar below the gums. There's no human element, as much of a human element, dependency anymore. And so it's been a revolutionary game changer for our group.
How much time is something like that taken in your schedule?
My time is 45 minutes.
Awesome.
Yeah. So the procedure.
But how much time does it take in the whole schedule?
The hygienist is in there about 2.5 hours with the scope. We don't rush them. They're getting faster and faster now that they've been using the scope for years, a couple of years now. Before it used to take me
Okay.
4 hours, but now we finished the whole procedure under IV sedation, probably in and out 3.5 hours, sleeping, no being awake,
For the whole mouth?
the whole mouth. Yeah.
Wow.
Yeah.
That's amazing.
Takes you about 30 minutes to open everything. They're already, when I walk in though, they're already sedated and numbed up by my anesthesiologist. So I just
Love it.
walk right in, I open, and then hygienist comes in for 2.5, 3 hours, whatever it is. I go into close, only takes like 10 minutes, and I do my occlusal adjustment.
Nice.
How's that compare to what you do, CS?
Almost identical. Just I have yet to implement the Perioscope. Sorry, Aziz.
Shout out, unfortunately.
Shout out, unfortunately, to that. But it's a technology I want to introduce in my practice. I'm just struggling, like the same struggle that a lot of people have. It's hard to find hygienists these days. I don't have enough of them in my practice to get this implemented.
You're thinking about it correctly, because we actually got all of our hygienists together before we bought the first few machines, because I go, you guys are not going to, embrace this. I don't want to invest in it. And it is a very
Correct.
difficult technology to embrace by hygienists, because it totally changes the way they practice. For example, we bought the XNav a long time ago. I got rid of that thing within like 6 months. It like ended up being a coat hanger, because I could do an implant in less than 10 minutes. And this thing was like, I'm like calibrating. I'm like, what the fuck is this? And just give me a circuit line, I'll pop it in. And so I sold it to my buddy.
200 grand coat hanger.
Yeah.
Right?
So I sold it to my buddy. It's an oral surgeon next door. I'm like, just take this thing, man. And so I equated very similarly to the Perioscope, because you're doing all your cleanings indirectly, and you have four-handed dentistry basically. So it could be very difficult for someone to adapt to it if they already have a happy routine.
Yeah, but I want it for the exact same reason that you said. I love that for an in-between, surgery is the gold standard. An in-between one is incredible. Like I don't have that in-between option for patients right now, and I would love to have that.
You and I can talk offline.
I think that's a good thing for periodontists.
We can talk offline on how
I think it's a good thing for periodontists to think about. Yeah.
I mean, should we call Aziz right now? Should we
call
phone
Aziz?
Should we phone a friend?
Phone a friend. Get the fourth person on. Come on, Aziz. Let's talk about this.
Oh, well, let's flip here. Let's pivot. Let's talk about average revenue per new patient among some other KPIs that you track at Root.
Yeah, I mean, the average revenue per, we keep that very easy, and different offices measure that differently. And our culture is very performance based. So, even though we talk about a lot of numbers, our people that work for us know that we're not like money hungry and greedy. Our philosophy is we're still a business. We need to be profitable. And as long as we do good by the patient and the team, then we should make that money. And the only way to track if we're doing well or not is to track KPIs. And so average revenue per new patient is a very, very important metric that I look at personally, especially between the doctors that we have, because you will notice patterns over months on who the doctors are that are not presenting adequately or not closing adequately, as well as their combination with certain treatment coordinators, depending on the data that we get from Referral Lab, which we use heavily every day. Any periodontist out there that's not using a Referral Lab, I'm not trying to put a plug in there. They need to. And even the people I coach in the DEO, I'm trying to get all of them to embrace the technology. But it really gives you an idea on two things. One, the conversion rates, what your doctors are presenting, as well as how is your marketing. When we did this $40,000 to $50,000, I don't want to name the company and bash them, but there's a couple companies that we worked with that were just horrendous. Our average revenue went from $4,100 per new patient to under $1,000. And these were all complimentary consults and CT scans. Just think about the amount of chair time that took, the amount of wear of tear on our technology, and just the frustrations of having a 2% closure rate versus a 70+% closure rate. So we started realizing that we told our director of marketing, Amanda, that when we hired her about a year ago, that we love that you're going to get new patients in the door. Like, love your ideas. That's great. But they have to be quality patients. And that number has to stay very consistent. And it has for us over the years after we got rid of those two companies. And so for us, it's a big number. We talk to the doctors about monthly. Along with that, obviously, we talked about case acceptance. That's I'm sorry, at the end of the day, this is sales. You got to be able to show the value of what we're presenting to the patients that are coming to you that need that value. And you have to be able to track that with the treatment coordinators
Yeah.
and the team leaders that are presenting treatment. And we have a live number now with Referral Lab. We look at this weekly. I meet with every team leader and every doctor myself every week, and we do what they call an L7, N7, last 7, next 7. And we go through the last 7 days of all the new patients that came in the door and the ones that did not close and why they did not close. And were there any alternative treatment plans that we could have presented that could have at least helped this patient out that was referred to us and that our marketing dollars used to get him in the door. The next 7 is to go over the next
Wow.
7 days of new patients as well to see how can we prepare for those patients
Love
before
it.
they walk in the door. And so that's been game
Wow.
changing for us as well.
Yeah, I think that's obviously thanks for the shout out with the Referral Lab stuff, but it's when practices really embrace, and Christy Bolts just did or University Nation Bolts just did a lecture on this at NASP. And she talked about, doesn't matter what KPIs you do, it's make them yours and make them count, right? And that was the kind of the purpose of that talk, which
Great
the
talk.
simplicity of that was really great. And when you own those KPIs, like you don't have to have 100 of them. The point isn't to have 100 of them. It's to own the ones that you've got and let those be. And what else comes from that is attention to the details of your practice. And you knew right away that the marketing wasn't working because it really tanked that KPI. Right. And so, and that's what Referral Lab does. And not to plug for us, but we provide another bouquet of KPIs that you can use. Not all practices are the same. What KPIs are valuable for Suyas might be different than what KPIs are valuable for Amit, right?
Right.
And Root.
What's amazing though is learning to read some of the data, Cam. I've always just been so impressed as, you can consult with somebody who's using the software and look at their stuff and, within 5 minutes, you're like, oh, you got a new patient problem, or you got this kind of problem. It's amazing though, how having that live data access.
I don't look at x-rays, buddy.
You don't look at x-rays, right? Like,
You do.
like we can look at an
Yep.
x-ray and be like, oh, you got this problem.
Right.
That's what Cam does with looking at the data. And it's freaking amazing. I mean, people are always blown away how you can, you sit down and look at the data and you can diagnose issues in the practice. I mean, there's great examples of that.
But the best part is when people like Amit and their team actualize that themselves and no longer need as much oversight,
Coaching.
right? And
Yeah.
that's when it really
That's the
gets
sweet
pretty
spot.
cool, right?
Yeah.
And then we get to go. Amit and actually Suyas and I were together this past weekend. We did this ridiculous omakase dinner, and we got to be friends, right? It was a little bit of shop mixed in and stuff too, but when you're able to have high level conversations with practice owners because they're really in tune with their numbers, that is pretty awesome time.
It's fun.
So when you're, as a practice like yours, Amit, that's really focused on growth with the amount of locations that you have in such a super competitive market, tell us a little bit about the new patient experience at Root and what makes it unique with some of your customized case management.
Yeah, so that's a great question because, being in a competitive market, obviously we need to differentiate ourselves from the guy down the street. I would say one of the biggest things of our new patient experience that's been revolutionary for us to connect with our patients. I'm still trying to get all my doctors to do this on a very, very intentional routine basis. Is before I even walked in the room, our assistants go through the medical history, take the photos, put the photos up on the screen, and they go through this customized questionnaire. And this questionnaire literally, I believe, is why my case closure rate is ridiculous, because I'm able to know more about this patient than anyone does before I walk in the room. And some of the questions that I'll ask are, I know all these are important, but you have to choose one. If you had to choose one, what would be the most important to you as far as the value? Cosmetics, function, comfort, or longevity? So they would answer that. Let's say they put function. So I know going into the room that they're not functioning correctly. So they have missing teeth. Let's talk about implants. I'm going to really focus towards that aspect. No matter what the referral says,
Cool.
I know I need to talk about that. Second question is if there was an objection or a reason why you would not get dental treatment done with us or anyone else, what would that be? Name one of them. Fear, time, no sense of urgency, budget, or no trust. Now imagine they go in there and they say budget, which a lot of people do. Now I know to go in and not to present like $40,000 worth of treatment. Let's pick the low hanging fruit and present. I'm still going to present comprehensively, but let's focus on this one aspect first and work our way up. And maybe we can treat this over 2 or 3 years. So that, and fear is the same thing. They mentioned fear. I'm going to go in with sedation ideas in my head. Hey, look, I had a really bad experience when I got my wisdom teeth taken out. I see you wrote fear here. Tell me more about why you're fearful of the dentist, and just get to know them for the first 3 or 4 minutes before you look in their mouth. The next thing we ask is, what is the most important quality that you look for in a doctor? That's, just an answer that I just want to know. And then this is the big one. Are you the type of patient that likes a lot of information or a bottom line? And I try to teach my doctors this because there's some patients I don't want to hear.
This is so right.
On what crown lengthening is. Like, they don't even freaking know what crown lengthening is. And now you're explaining it to them with diagrams. They just want to know if you can save the tooth or not. Right. And so by knowing this going in, I can cater my consult to be very short. And I even say it, I go, I see your bottom line. I'm going to skip the diagrams. I'm going to just tell you what you need. They want a lot of info. I'd be like, I see you want a lot of info. I'm going to just give you as much info as I can. Let me know if it's too much. And then the last thing I ask is,
pull out the diagrams and start drawing.
That's so gold.
That's
gold.
So gold.
So
right
Amit, I've been at your practice multiple times. So that's the questionnaire that they fill out with the dry erase board marker. Yeah.
Yep. And then the last question is,
so he's got it. Yeah, go ahead.
Yeah. The last question is, what are your goals and expectations from the visit today? And the reason why we ask that is sometimes they're like, I want to get out of pain today. I want to get this. So then I know it's same day. So I'll have my girls in the back ready to possibly set up a same day extraction or same day procedure. So we try to stay ahead of it. And I even say, look, our goal here is to do same day emergency treatment. I see that you want to get this done today. I can make it happen if you want to make it happen. And our same day has gone up substantially in the last few years by implementing this sheet.
That's awesome. It's a wonderful way to help you customize and tailor to each patient and deliver them what they want.
Exactly.
I think that's absolutely fantastic. Fantastic.
Well, it's all psychology,
I saw
right?
Cia's was taking notes.
I really was, dude. I was like, I'm listening hard on that one because I was like, ooh, I like these a lot.
I love how on that questionnaire you got bottom line, because that gives those people an opportunity to say, listen, I'm here because you're the expert. I don't give a shit. Tell me what the problem is and how we're going to fix it.
Right.
Yeah.
Not in 45 minutes.
Right.
Well, I mean, I think a lot of times we forget that a lot of these patients don't want to be in the chair for an hour and a half. They have other shit to do too. They have to go back to work. They got a meeting potentially. And I think a lot of times we think that we're keeping them longer, it's a good thing. Sometimes it's not for these bottom line people. And you could actually piss them off enough where they won't do the case if you take way too long. And they said, I'm bottom line.
For sure.
Right?
For sure.
Yep.
What's the percentage of patients that say that they're bottom line, you think?
We don't enter this data, so I don't know that, but that's a great question. I would say, I would honestly say more are, I want a lot of info because they just don't know what's going on.
Man, I think you should track this for a little bit. You should track this for a little bit.
Yeah.
Attributes.
We'll start
baby.
for 2026. We'll start. It's a good idea.
Track for a couple months and just see what happens. Yeah. And I'm gonna bet you're gonna get some cyclical responses, seasonality in some of the responses. Right. And now Amanda's like, when she listens, she's gonna be like, oh my God, that's where this damn new exercise came from. Cameron asked Amit to do this shit on the show.
Yeah. I mean, we scan the sheet into every patient chart, so we can literally go back to all the new patients like in the last few months and just pull it up.
Oh God, your team's gonna hate me. I'm so sorry.
Audit.
Sounds like a lecture,
Chart
dude.
audit.
I hear
it
a
does
lecture.
Sound like a lecture. There is a good lecture there.
There is. Oh man.
So again, it's different when you got 1 or 2 practices and a couple doctors. It's significantly different when you got 7 and you've got, I don't know how many team members that you have. Obviously, you're looking for new technologies to support your practice. What's Root doing with AI?
A lot of our AI is on a telephone standpoint. We have that. I think I talked a little bit about that in NAS, where it will record your phone calls, transcribe it, and then put it into the patient chart. That's changed our like tedious task on that aspect, and record keeping. It's helped that because sometimes our front desk will make a call to a patient and not record it, and now that they'll call back, and the next person that answers the phone has no idea what was discussed. So this all gets recorded onto the chart. I would be very careful about some of the AI technologies for periodontal practices. For
Absolutely.
example,
Absolutely.
I don't want to say anything negative. I think they're a great company, Pearl. We had them in all our 7 locations for quite a while, a few months. And the reason why we decided to bring Pearl on board was like, you know what? One thing that we want to make sure we do with all of our referring doctors that work with us is increase the ROI for them working with us. We want to be able to, give back to them like they give to us. And one thing that we believed Pearl would have done for us on our alternating periodontal recall appointments is help us diagnose caries. That because we know most of our referring doctors are not implementing AI technology for whatever reason, usually financial. And so we're like, all right, well, if you start diagnosing these caries or potentially diagnosing them and putting them in our report and sending it back to a referring doctor to call the patient to get them in to see if these are truly cavities and to treat them, this will grow their restorative practices. And we have thousands of patients.
Smart idea.
Well, we thought so. And, this is where, I got fucked again. And so what would end up happening is some of the doctors would get these reports, call the patients in, and then there's nothing because there's so many false positives. And then the argument is, well, go in there and check all these cavities. I'm like, I'm not going in there looking for cavities on my
no.
Like if it's blatant, yes, like go. But the ones that are subtle that show up on Pearl and I can't really tell, I need someone to look at it, like a restorative doctor. It's a problem. And the problem is that by not referring it back when it pops up, I don't want to be liable for that. And the patient's like, well, you didn't refer me back for that. So it was like a lose-lose situation. And then we were starting to get calls from patients like, well, I just wasted my time there. I got an exam done. And even with our change in verbiage and this and that, the restorative doctors, our doctors don't yell at us or get pissed at us. They're like, hey guys, maybe this is not working. And so we're
never a fun conversation.
It's such a good idea though.
It is a good idea.
Yeah. I never even thought about using it that way.
There's really not I hope Cameron, maybe you and Jason and Seta can come up with a technology that can look at progressing bone loss. Pearl would not measure the bone levels from, it could not compare the bone loss levels from visit to visit. You had to physically do it yourself, which is impossible on all the probing depths. And so the technology is not there yet, I believe. Yeah. There's no unless it's changed in the last few months, there's nothing that shows, all right, here's your bone back then, here's your bone now. Like you have to physically put 2 screens up next to each other. It wasn't a comparison. And so we just said for us, it wasn't worth, I think $1,000 a month or whatever it was, total. But it's a great idea
to get those phone calls. Phone calls.
Yeah.
I know Trios has something like that with their Trios 6 scanner, but it obviously can't measure bone levels, but it's doing that with recession, right?
Sure.
And where they have that comparison over time, that's this compare software that does it with AI. It's pretty sweet. But again, I know the technology is going to be there one day, but man, it's a great idea. It's just a little too far.
We're going to be on a beach.
Time. Yeah, we'll be on a beach.
The 3 of us will be on a beach.
Yeah, I think it's there. I think a lot of the stuff that we're doing manually will be taken over by AI. There's still got to be a little bit of a human element, right? But a lot of this stuff can be done automatically, like the progression of bone, loss. Someone should figure that out. The angle of the x-rays too, right? If they're different from the last visit,
changes.
Things change. There's so many different variables that can affect what the actual data is. And that's a problem.
Right. Yep.
Yeah.
That's why, you still need a human eye. And that, we talked about this at the meeting is, 10 years from now, AI is going to be ubiquitous. It'll be in everything we do. Right. It's another tool that's going to take over things like that. And it will get better and better as we progress with it. But once it's everywhere, your competitive advantage becomes human characteristics again, being able to connect with people, doing those customized questions like you're talking about. I think that connection level is where it's going to go, and really what gives practices and people an advantage is going to be human skills.
So with a practice, again, what's cool about my relationship with Amit is I've been I've been a partner of his since practice 2. He had just moved to practice 3 when we started working together. And so near and dear to Amit's heart is hidden revenue leaks. We have regular conversations about. He's shaking his head. For those that are listening and not watching, he's shaking his head and he's getting frustrated already. You know, this is something that plagues all practices of all sizes and shapes. But as you pick up more practices, it obviously the smaller leaks compound. And so, Amit, let's talk a little bit about some of these revenue leaks that have been that you found over the years, and some of the ones that that drive you crazy today.
Yeah, there's definitely leaks, but a lot of it is not intentional, and some is. The ones that are intentional are ones that piss me off. And so I'm not a big fan of, and I was finding this out through the years, and my girls know about it, so they're not going to be surprised when they listen to this podcast, if they ever do. But taking off certain things on a treatment plan just to close the case, that drives me nuts. Like, let's just take off let's take off the PRF. Let's take off the M to gain. Let's take out the Gem 21. But we still want to use it, but we're just going to take it off. And as an owner, I'm like, fuck that. I got to pay like $300 for that biologics, and you're drawing blood. We have a PRF machine, charge for it. So I feel that we give away too many things for free. And that's probably the number one, revenue leakage that we have. And you multiply that across 7 offices. It's ridiculous how many, probably hundreds of thousands of dollars, if not millions, it may add up to over the years. And so we started getting very strict about that with the treatment coordinators and the doctors on, even surgical guides. Like, let me just throw a surgical guide in. I go, that's $500 or whatever we charge for it, and then someone's got to make that guide. We got to buy the components for it. So that was one thing that we've learned over the years, is trying to minimize that leakage. You're going to have some of it, right? Obviously.
Yeah.
But that was a big one or multiple things within those categories that we were just losing and providing the service for.
Ciaz and I just had this conversation last week.
Going to bring this up.
I took it from you.
Such a great way.
Guess what? Guess who's here? Roy jumps in mid podcast. Welcome to the host. Welcome to the other host.
Welcome back.
We're talking about. We're
Looking
talking
like a
about
movie star.
You're allowed to have 2 brown people on this.
I can't wait to.
What's going on here?
I can't wait to see. Right now, the producer's probably shaking her head, going, "How in the hell am I going to cut in Seda with 10 minutes to go?" So, Amit, Ciaz and I were talking about this last week, and why do bars close? Because the owners drink the beer. Okay, and so what does that have to do with this, right? And when you've got, when you're giving away things here and there, right? Especially things that have, expense to the practice, and you've got a 10% profit margin, right? Not you, but let's just make the numbers easy, and that thing costs you a $10 hard cost. You have to make $100 to pay for that. Mm-hmm. And so people don't think about that math, and that's what closes bars. Right. And closes restaurants is when people are eating their own goods and services. Right. And so when you talk about that leakage there, team members don't think about that, because they're like, oh, especially when you got 7 practices, oh, this one little thing isn't going to hurt the practice. They don't think about the fact that everyone just said that 3 times today across, 7 locations. And we just gave out, $1,000 worth of stuff, right? That cost us. Right. And we have to make $10,000 in production to cover the $1,000 worth of stuff so for those of you listening, like, that'll quietly kill your business very quickly. It'll chew into, especially if you don't have monstrous profit margins, that will chew into your bottom line quicker than anything else. That's such an astute thing to bring up. Thank you, Amit.
Yeah.
So you got comments on that?
Yeah. I mean, it's, I think the most common one I see is like people who give away products in the office. Like, here's the rinse you need, and they don't charge for it or build it into the fee. Here's the the stuff you need, stuff you need. It's really important, and it adds up over time. Like, either the challenge is if you're a participating practice, you can't really include it in your fee because you're getting written off anyway, right?
Right.
So your full fee doesn't matter when you participate. If you're a fee for service practice, at least build it into your fee if you're going to give it away. And so, account for that when you do those things. That's important.
Seda, you got comments on this? Since you haven't been here, you can chip in a little bit.
I'll just kind of mention, I'm like the biggest like offender of that rule, It's
That's
like,
why I asked.
yeah. It's like, whether it's giving stuff away or discounting fees, it's like, and I've got to have my team are usually the ones that are like stopping me from doing it, And a lot of times, like our own previously conceived notions of what we think is fair, or what's a lot of money, or it's like a lot of times we're wrong about those things. And so I think having structure around it and having conversations about it with team on an ongoing basis, so that it's like top of mind for everyone, that this is something that can kind of like sneak up on us, and before you know it, we've written off thousands of dollars at the end of the year, or as you mentioned, products or whatever. So I totally agree. And it's something that I learned the hard way. To share my story about it, we have an annual plan with our consultant every year where we kind of look at the numbers from the year before and then project for the year after. A lot of the decisions we make throughout the year are based on what happens during that plan. And as we comb through all the data, profit and loss statements, practice software printouts, referral lab data, et cetera, it's very eye-opening to see what you thought was just a small percentage can in fact be a huge percentage. And
this must be must be a pain point right now with Sades.
So yeah, I'm like the poster child.
So let's for the team members that are listening, because we have a fair amount of team that listen to the show too. When you've got a doctor like Dr. Michael Seda, the number one offender in the country, that is giving away, like, how does your, can you give some guidance, Sades, on how you've instructed your team to help you with this?
Yeah. I think it first starts with just really having aware team members that also can empathize with me as the business like manager like owner. It's not something that I inherently coached to people. It's really them looking at things and kind of having compassion for me and realizing how hard we all work, and that, there shouldn't be freebies. And so as with a lot of things, I think in practice, it really just starts with the character of the people that you hire and bring on to be on your team. And I know, Suyas, I've met so many of your team members, some of them having been there longer than you, I think. And the loyalty and
the baby Suyas.
The dedication they have to the practice, they want to see the practice succeed. And, I think that's kind of their guiding light, and really things being done a certain way. And a lot of times left to my own devices, as you all know, it can be a tailspin. So having their support when it's appropriate, I feel very blessed actually that they're looking out for those things.
Just coming in and dropping bombs, man.
No, that's a great bomb. That's it. Boom.
Drop the mic.
Drop the mic. Boom. That's right.
Peace.
No, we did this is a great point. And so like we were able to do a little study in our practice and track, we looked at how many times we're given like bone graft and membranes away without charging for it.
Oh.
And do you remember that? You remember this? Yeah. It added up to like $35,000 over 6 months.
Yeah.
That's 70 grand over a year. That's a whole nother employee, right? Like, holy smoke. So like we decided, we're like, man, we stopped this. We discovered that back in 2024. So we changed it just recently in 2025. But Amit, bringing this up is so important. Like we don't realize how many times we're like trying to give stuff away to do this.
Taking something from the service industry, there's something to be said about giving things away. Like if you go to really high dollar places, you'll see that they're very purposeful in what they extend, right? And they know what things they should and should not extend, right? And they make you feel special with those extensions, right? And so if you're feeling that this is something that you must do, or, is near dear to your heart, feeling like you're contributing, like, be really purposeful about this stuff. Like, what isn't going to, what isn't, I mean, I think about, what is it? Red Robin, right? Is that the
Hamburger
burger
joint?
place?
Yeah, that's the
Burger
burger place.
place.
You know what they
Yeah.
give you a shitload of?
French fries.
Fries. You know why? Because they're cheap as shit, right? And so, like, that's the thing. Like, if you're gonna be giving stuff away, like, be purposeful about it, and so that you're not, smoking your bottom line, because that's a huge hidden revenue leak, because it compounds over time. So, go ahead.
Do we got time to talk about the flip side of this, or are we done? Like,
No,
what
we
about
got a couple minutes left. Go ahead.
hidden revenue potential, Amit? Talk about that a little bit.
Yeah, I think, so, I mean, we obviously uncovered it and have now, we're okay. But, I think in a periodontal office, every single maintenance patient should have LBR. Like, laser bacterial reduction should be on every single periodontal maintenance patient. We charge $50. And by adding that in, it's just a D499
See,
code.
is taking a note.
It's not going to be covered by insurance at all. When we do our lunch and learns, I highly encourage all the general dentists that we lecture to buy one. It's much better than a Reston or a Perio chip or anything else you're going to put into the gums. And patients love it. They're asking for it. Now, when we alternate, our referring doctors are like, what are you guys using over there? Because they're asking for the laser and we don't have it. So imagine all of your hygiene patients just bumping them up $50, depending on your demographics, and showing the value of what it does. That's huge. And so, we also started adding in surgical guides on every single implant case. But as far as procedural hidden revenue, another one that we just added is we get so many, symptomatic patients of sensitivity. And Voco has a great product now that I think we charge like $400 or $500 on, where you're able to put it on to every tooth. It takes about 30 seconds to brush it in, and then you light cure it, and their sensitivity is gone. And it's pretty cool. It just came out like a few months ago. It's been game changing for us, especially the patients that complain about sensitivity after surgery. It's very cheap also. So that, like Cameron said, that's a very intentional giveaway if you really want to do that. But in general, most of the patients that we see are sensitive to some extent. I think there's just a lot of things in perio that we're limited to do in maintenances, because we don't want to step on the toes of our restoring doctors. We're very, very good about that in our group. But there are other things that we can treat that they're not treating. And so I think finding those hidden revenue procedures that are actually helpful to the patient. Everything that we do in our company has to be helpful to the patient. We're not just doing it to drive revenue. There has to be a value behind it. And we tell the patients the value behind it.
Are you
Absolutely.
just, as an owner of a large group like that, you've got a lot of associate doctors, right?
Correct.
Are you paying attention, like your surgical guide, like your fees $400, but you said what it costs you $400 to get a guide made. You have to set a fee on that at least you as the owner or however you split it with your associates is not costing you money, right?
That's a great point. The way we navigate around that is, let's say it's $1,000 procedure or product, and the cost of that product is $400, like you said. Then we just pass that on to the patient. So the doctor would get paid actually their percentage of $600, not the full $1,000. Because I don't make money on the 400, they don't make money on the 400. It literally went from the patient to the product. So it's a very fair system. We actually do that with, you'll be surprised, we do that with third-party financing fees too. If something is $20,000 and Care Credit takes 10% of that, which is $2,000.
That's a spot.
We actually will pay them on $18,000, not $20,000, because why am I paying them a percentage of money that I don't realize? That's going straight to Care Credit. They shouldn't get a percentage of that. That is something that every doctor of mine has accepted because they realize the math doesn't lie. I'm not making money on it. Why should you make money on it? And so that's something that should be implemented right away with any associate and any practice in general should be implemented if you have associates. I'm gonna get killed here.
It's a great point. No, man, no.
Amit suddenly gets death threats from associates.
That's fucker.
No. Well, we're so grateful that you joined us today, Amit. honored to call you a friend. And we had such a great time this past weekend. For those listening, we were at the North American Society of Periodontists annual meeting. People are interested in learning more about that. Reach out to Jason Suyas. He's a core member and is happy to tell you more about that.
Thanks.
You're welcome.
Yeah. All right. Good. Happy to.
So Amit, we talked a lot about saving teeves. We talked a lot about saving lives,
Teeves.
right? We talked about saving money, and so super grateful that you joined us. I don't know. I said teeves. Super grateful that you joined us today. Thanks so much for joining us on the special list.
Thanks for listening to The Special Lists, presented by Referral Lab, the podcast for dentists and dental specialists, featuring a special list from a specialist. Got a question for us? Send us a message at speciallists.com with 2 L's. Transform your referral workflow with Referral Lab, a purpose-built platform for dental specialists to track, manage, and convert every referral. Request a demo at referrallab.io.